Even though Illinois is fully reopening, some doctors are warning to still take precautions because the pandemic is not over.
Joining us now is Dr. Mark Loafman. He's with Cook County Health. Thank you so much for joining us, Doctor.
Nice to be here. Thank you.
Well, that is key. The pandemic is not over. Whether you're vaccinated or not, whether you wear masks or not, you are still prone to getting COVID, especially with the new variants.
Yeah, we're still concerned. I mean, I think there's a nadir in the cases and the hospitalization rate that sort of allows timely reopening. So I think it's reasonable to have a reopening, but we're not done. We still want to take precautions, and I think if people don't, we will see a surge in the fall.
Well, having said that, I mean, for a lot of people, this is such welcome news. It's been a long, hard, sad 15 months here, so it's nice to finally emerge from that. But at the same time, are you worried about a surge among unvaccinated people as the summer goes on?
Yes, that is the concern. I mean, I think, again, the case rates are low enough now, and there is a combination of vaccinated immunity. There is some natural immunity, so most crowds are fairly safe, but we're going to see that natural immunity wane. We'll see more virus start to spread. So we just hope people will do two things: follow the precautions when you're close together, and also get vaccinated. If you're not vaccinated yet, please get vaccinated.
You say precautions. What precautions should we follow? What do you tell your family?
Yeah, I think so. Outside seems really good. So if you're vaccinated, being outside, if you're vaccinated, being around other unvaccinated people, that's good. It all works fine and we can get back to normal. The issue is when we're in public spaces and it's crowded and we don't know the vaccine status of those around us. So those are where we continue to wear the mask. So we're asking people, carry the mask with you, keep it there. Let's say you're going to a ball game, you're in the corridors, it's crowded, leave your mask on. When you get to your seat, it's reasonable to take the mask off outside. So that's the kind of discretion that we want everybody to do as we continue to try to encourage vaccination.
You know, it seems that vaccinations have flattened. Maybe there will be, a few more that happen as the year goes on here. What about families with kids that are too young to get vaccinated? What would you say to them?
We have to continue to protect them. They have a small chance of becoming sick. We are seeing some post-COVID infection complications in children now, so we don't want them to get sick. And they, of course, also can spread the virus around. So we're still going to be taking precautions for them. So parents with young children are not going to be able to open up quite as much yet as the rest of us can.
Doctor, what about people who have not gotten vaccinated, period?
Yeah, it's a tough call. I mean, I was on a group call earlier today when we're trying to talk about strategies to help people accept vaccination. And, we've seen this with every public health movement. When it first comes out, there's resistance. Over time, there is acceptance, and we're just hoping that happens. I think one key message is that the variants right now are being covered by the vaccine. That won't necessarily always be true. So more vaccination would really, really help us get this virus at bay before a variant happens that the vaccine doesn't work for.
And we should say that just because you're vaccinated doesn't mean that you can't get it. You just won't show as many symptoms, correct?
That's what it is. So we're not seeing people get sick who have been vaccinated, but there are some who test positive. And what we know about that is their viral burden is lower. They're less likely to spread it and share it, but it's not zero risk.
All right. Thank you, Dr. Loafman. We appreciate your help. Be safe, be well.